I had a stroke 6 months ago. When it first happened, I was confused. I really didn't know what's going on because I was 18 and I had a stroke. So it took a while for me, even when I was in the hospital, to realize that I had a stroke, and I really couldn't move my arm and my leg. I thought that I would regain that after the surgery or something like that. But no, it took a while for me to understand that it was long term. It was something that I had to work at.
We spend a lot of time on basic activities in the developmental sequence. Just like a child would learn how to roll and to crawl. We're doing the same thing, just at a very different level with a brain that's had some damage.
When you've had neurologic injury, you have to have a relearning process of how to use that limb again, because it's not that automatic task that we take for granted anymore.
I was working hard throughout the day, and it was a lot of work.
The big one for us is walking, getting up, and that's by far everyone's goal in physical therapy. They want to walk.
Within the first couple weeks, I could stand, and then slowly I was able to walk.
When they get to the point where they can walk, and Daniela was a classic example, okay, once she got up, she went.
Walking used to be second nature to me, and now it's I really have to think about it.
We might have 40 patients here on an inpatient unit, and each one of them has a different reason for why they might want to walk. Maybe it's a new parent that wants to be able to move with their child. Maybe it's an athlete that can't quite fathom that they'll never be able to be an athlete again. And you try to figure out on a personal, individual level with each patient what it is that motivates them to get better.
I'm hoping that I'll go back to Oregon for school, and that entails walking around the campus.
Walking is something that most of us take for granted, but people who have lost the ability to walk have to think through every single step.
Before, whereas the happiness might have come from a 1-mile walk, you'll see here it comes from going 25 feet in the parallel bars or 25 feet with a walker.
Because people always want to walk, but that might be someone's long-term goal. And unless you have a short-term goal in between that actually keeps them being realistic about what they can do and can get to, then sometimes they lose hope. And hope is something I think that we strive to keep alive.
A few months ago, I wouldn't be able to walk, so I feel good that I can do that now. It made me feel wow, this is good. This is what I was working for. I didn't used to walk for fun. Now I do.
Hi, I'm Mansi, and I'm going to talk about stroke and effects of exercise on stroke after rehabilitation. The outline of my presentation is to be stroke smart on the clinical presentation of stroke, which are the signs and the symptoms, the research on rehabilitation, and conclusion. The objectives are to enumerate stroke facts, to understand the rehabilitation after stroke, to analyze the research done on effect of exercise on stroke patients. Definition: it is basically a condition which occurs when there is a lack of blood flow to the brain due to some clot or rupture of a blood vessel. It usually causes sudden brain damage, and it is also called a brain attack. There are 3 types of stroke. First one is the ischemic kind. It is a clot in the brain, and which just occludes the blood vessels. The second one is the hemorrhagic kind. It is about internal bleeding The third is transient ischemic attack, TIA. It is also called cerebrovascular accident or cerebrovascular insult, CVA. It usually causes muscle weakness, which is on one side of the body. Then there is side of the face, which is drooping down or feeling numb. Then there is speaking difficulty, loss of balance and coordination. There is loss of memory and trouble seeing. Here are some symptoms of stroke. It is sudden confusion or trouble speaking or understanding. Then there is sudden trouble seeing from one or both the eyes. Sudden trouble walking, dizziness, loss of balance and coordination. Sudden numbness or weakness of face, arm or leg, which is especially occurring on one side of the body. There can be headache, which can be severe and sudden without any known cause. People usually don't respond to some symptoms, and it can lead to brain damage, which they don't respond to symptoms because they maybe don't recognize it. Sometimes they fear or are in denial, and sometimes they worry about the cost of the rehabilitation and the hospital costs, and sometimes they just don't know if they could recover from it. Here are some social impacts. Stroke is a leading cause of serious long-term adult disability. Over the course of a lifetime, 4 out of every 5 families in the United States be touched by stroke. There are up to 80% of all strokes which are preventable. Every 40 seconds, someone suffers a stroke, and every 4 minutes, someone dies from stroke. The National Stroke Awareness Month is May. The National Stroke Association encourages everyone to spread awareness about stroke in May, about how to participate in the awareness spread, then how to educate and advocate, how to influence public policy and legislature on stroke survivor issues, how to spread the word about stroke awareness, and how to get involved and make a difference in the world of stroke. Here are some stroke facts. It is the 4th leading cause of death in the United States. There is a huge number of people who in the US suffer strokes each year, and there are a lot of number of people who die. From 1998 to 2008, the stroke death rate fell approximately 35%, and the number of deaths by 19%. There are 7 million stroke survivors till now. Women and stroke. Stroke kills more than twice as many American women every year as breast cancer. Women suffer greater disability than men do. More women than men die from stroke, and risk is higher for women due to higher life expectancy. Women from age 45 to 54 years are experiencing a stroke surge, mainly due to increased risk factors and lack of prevention knowledge. How to be stroke smart. We can reduce the stroke risks, and we can recognize stroke symptoms and help prevent them. We can respond at the very first sign of stroke and call 911 immediately, as every minute counts when someone is having a stroke. How to diagnose it? A physical examination, including taking a medical history of the symptoms and a neurological status, helps giving an overall evaluation of the location of the stroke and how severe it is. It can be graded on a scale which is standardized, for example, the NIH stroke scale. It can also be diagnosed by CT scan and MRI scan. Stroke strikes fast. F is for face. If you ask the person to smile, the person may not be able to do it, or the person's face may droop to one side, or the person's face may feel numb. A is for arms. If the person has to lift both the arms or raise them, he may not able to do it. S is for speech. Ask the person to speak a simple sentence without fumbling, and the person may have difficulty in doing that. T is for time. If you observe any of these signs, call 911 immediately. How to prevent it? You should know your blood pressure count and should have a regular checkup done. If you drink alcohol, do so in moderation. If you smoke, you should stop, as smoking doubles the risk of stroke. You should find out if you have irregular heartbeats, which is also called atrial fibrillation, and patients having heart disabilities, they have the highest risk of stroke. You should have a low sodium and low fat diet. If you have diabetes, you should try to control it and follow your doctor's recommendations. You should know your cholesterol numbers and even try to keep that in normal limits, and include exercise in your daily routine. Acute stroke treatments. For the hemorrhagic stroke, which is the internal brain bleed, it can be treated by coiling and clipping. The ischemic kind of stroke, which is the blood clot, it can be treated by clot busting mechanism or medication, and which is the TPA, tissue plasminogen activator, and there is clot removing devices, there is penumbra, and there is Mercy retriever. Here is the Mercy retriever. It is called the mechanical embolus removal in cerebral ischemia. It was designed by University of California in 2001, and Mercy was the first device approved in the US to remove blood clots in patients suffering from acute brain ischemia. Stroke recovery is just 10% of the patients who recover completely, and there are 15% patients who just shortly die after a stroke. Perceptions about stroke. There are some myths that it cannot be prevented or treated. It can only strike in elderly, but it can happen to anyone at any age. It happens in the heart, which is a myth, but it is actually a brain attack. Recovery ends after 6 months, but it cannot be true, as stroke recovery lasts a lifetime. There are types of rehabilitation. There is occupational therapy, which is taking care of oneself. There is physical therapy. It is about how you achieve the range of motion which is lost, the walking, the balance and coordination, and your skills. There is recreational therapy, which includes doing something you like cooking, gardening, etc. There is speech and language therapy, which teaches us to swallow and helps in the communication problems and cognition. Lifestyle changes for survivors. There is change you can make in the diet and nutrition, and you can change the daily living skills like dressing, grooming, etc. There can be changes in the behavioral type, and there can be anger, pain, depression. There can be memory loss and communication problems. There are types of recovery services. There is homebound therapy, inpatient rehabilitation facility. There are community-based programs which help in the recovery in a group setting. They help in rehabilitation unit in the hospital. There is long-term care facility, and there is home with outpatient therapy. There are some studies done on the effects of exercise after stroke. Some research has been done on how the exercise affects on the leg function and how it affects the upper limb, the balance, coordination, etc. This study is about the impact of physical therapy on functional outcomes after stroke. What's the evidence? The results in this show that there is a strong evidence in which functional tasks are directly and intensively trained. There is another study which talks about strength training and how does it improve upper limb function in individuals with stroke. The purpose is after stroke, maximal voluntary force is reduced in the arm and hand muscles, and upper limb strength training is the first intervention with the potential to improve function. So the results of this study show that there is evidence that strength and training can improve upper limb strength and function without increasing or aggravating any kind of pain and tone in the muscles of the individuals with stroke. This is an interesting study which talks about the effect of an intensive exercise program on leg function in chronic stroke patients. A patient, it is done with a 1-year follow-up, and it is a pilot study. The objective is to investigate the effect of 2 weeks of intensive exercise on leg function in chronic stroke patients and to evaluate the feasibility of an intensive exercise program in a group setting. The design of this study is that it is a pilot study with one group pre-test and post-test, and with a 1-year follow-up. The setting was inpatient rehabilitation hospital. There were 12 hemiparetic subjects who took part and completed the intervention, and there were 10 patients who participated in the 1-year follow-up. The intervention is there were 6 hours of daily intensive exercise for 2 weeks with focus on weight shifting towards the affected side and increased use of affected extremity during functional activities, and insole with nerves in the shoe of the non-paretic limb was kept to reinforce weight shifting or weight transfer toward the affected side. On the conclusion, it showed that the intensive exercise for lower extremity is feasible in a group setting and was effective in improving ambulatory function, maximal gait velocity, and muscle strength in chronic stroke patients. Most improvements persisted at the 1-year follow-up. The conclusion or take-home message is stroke is a medical emergency. If you have signs of stroke, take action fast. Every minute counts when stroke is about to happen or someone is having a stroke. The longer the blood flow is cut off to the brain, the greater the damage. Immediate treatment can save a life and enhance the chances of a complete and a successful recovery, and be stroke smart. These are some of my references. Thank you for listening to me.